Hi, my name is Mark Newell. I'm the Director of Research for the Medway Research Institute. Some years ago I was asked to develop a research program for a device called the FastsizeExtender, which was a new penile traction device, and this is it, I have it here, which is used for a couple of purposes. Initially for phalloplasty, which is enlarging the penis. My research involved Peyronie's disease, which is a disease caused by injury of some type or growth of scar tissue in the penis. This is scar tissue that doesn't expand, so that when an erection occurs, that lack of expansion causes a curvature. It can be painful, sometimes it's not painful, it can be slight in terms of curvature, or it can be curvature so severe, 90 degrees sometimes, that the patient is simply not functional in terms of being able to have sex. The research program I designed was built around this device and its use over a 3 to 6 month period in order to treat that particular disease, Peyronie's disease. And we discovered that after a period of 6 weeks, gentle, long-term, up to 8 hours a day traction on the penis actually began to break up the plaque and reduce the curvature. These were trials that were conducted by Dr. Lawrence A. Levine, FACS of Chicago, and were reported in publications which he and I wrote, papers we wrote in various publications during 2007. Those results pretty much showed that over a 6 month period in the patients in the study, correction of Peyronie's occurred to a very high degree. Some patients achieved a 45 degree correction. In other words, one patient with a 90-degree bend was able to become functional. We also noticed during that trial that the device created girth and length for the patient. In one case up to 1 inch, and that patient achieved an additional ½ inch by further use of the device after the trial. So we know it works. The actual principles behind it are still being researched, and we're also using this device to see what it does to help patients in terms of penile rehabilitation, and that is the expansion process that we know now occurs may be creating new nerve tissue, new vascular tissue, as well as muscular tissue. This may be of great benefit to patients with ED. We certainly also believe it'll be of value to patients having implants. A certain degree of penile atrophy occurs in patients with long-term ED. These are usually the candidates for implants. This is shrinking of the penis. And use of the FastsizeExtender enables these patients to gain length prior to surgery, which means they can have a bigger implant, and that leads to greater patient satisfaction, which is very important. This is going to be the topic of a new trial that we're now developing with several companies in the United States, and we'll be reporting on in the next year or so. This is an important device for the new applications that we're beginning to discover for it. And as such, it is the only device on the market today that is supported by the medical community, has been researched by the medical community, and has a protocol which basically is a written course of treatment behind it for the use of the device for Peyronie's disease. These are all very important factors when considering which extender device to use for treatment of Peyronie's disease, or for rehabilitation, or even for phalloplasty. It is always important, of course, to have the supervision, or at least the overview of a doctor, your own physician, when you're embarking on a course of treatment using a device like this. But the important fact is that we now know that penile traction does have benefits, it does work, and it can have real possibilities for improving the lifestyle of patients with ED and with a need for rehabilitation and correction of Peyronie's disease. So, very useful device in that respect.